Dr. Adalja, thanks so much for being here. I want to start with this staggering record figure. When are we going to start seeing these deaths go down?
It's going to take some time because these deaths reflect infections that have occurred 2, 3 weeks ago. And remember, deaths are going to lag. So it's going to be some time until many of the vulnerable populations are vaccinated. For example, nursing home residents, before we start to see an impact on deaths. So I do think we're going to be in the thousands for some time, and then it will start to ebb as those vulnerable populations get access to the vaccine, and we see them less represented in the numbers of the hospitalized, and then the deaths will sort of come down.
Dr. Adalja, is this the surge, the post-Christmas holiday, the post-New Year surge that we were expecting, or is that still to come?
We're still sort of at a plateau that's kind of been ongoing since probably before Thanksgiving, but we are seeing it kind of ebb and flow with holiday gatherings, with more cases. And if you look at the sheer number of cases that are occurring in a community, it is very high, and it's going to remain that way for some time. So I do think we are seeing some of the effects of Thanksgiving, Christmas, and New Year's now, and it will continue. And I think it's now become almost the new normal that we have this high level of cases, this very high plateau, or even increasing in some states.
The U.S. government is recommending that states start immunizing people who are 65 and older, as well as others who are more vulnerable to serious disease. Easier said than done, obviously. What are the challenges that come with expanding this eligibility?
Well, the big challenge is that we have to now reach people in the community. The first immunizations were people that worked at hospitals, worked at nursing homes, or resided at nursing homes. So those are kind of captive audiences. So they're much easier to get access to. Now we're talking about people in the community. So that's going to really require a lot of resources, a lot of coordination, a lot of public announcements so people know it's their turn to come and get vaccinated. And we know that our state health departments and county health departments are under-resourced, understaffed, and still trying to manage all the contact tracing and everything else at the same time. So hopefully they have the resources to do this. There was a bill signed on Christmas weekend that gives them money to do this. But we want to get vaccine into the arms of people. That's the only way that this ends. That's the only way that this vaccine is valuable. It's not valuable in the freezer. So we've got to move faster. We've got to make this basically all hands on deck, warlike effort to get vaccine into people's arms and meet these health departments where they are and see what help they need from the federal government and allow that to happen.
I'm just wondering when you think is a realistic timeline that we will be on the other side of this pandemic. Given that we saw the first shots go into the arms a month ago at this point?
I think it's probably going to be late summer that we're on the other side of this pandemic. We will start to see benefits before that. Like I said earlier, if we can get our nursing home patients vaccinated, if we can get the community dwelling high risk individuals, we're going to see the pressure on hospitals kind of lift. And if the pressure lifts on hospitals, the risk perception will change because it's when our hospitals are in crisis when we have to be the most attentive to what's going on with this pandemic. Once hospitals are in a better position, I think you have some room to breathe, and you'll start to see some of the states remove the restrictions and people be much more comfortable going out and doing things. But I think if you're talking about getting back to what it was like in 2019 or some semblance of that, I think we're talking about late summer.
Dr. Adalja, I speak to experts, you included every single day, about what we can do in the meantime to protect ourselves and protect others. And we hear the same advice over and over again. Wash our hands, stay socially distant, don't spend time with other people, wear masks. But as Americans, if we look at the data, we are not doing that because we are seeing cases and deaths continue to go up. Do we need to reassess the messaging here because Americans just aren't following these guidelines?
Well, I think what we have to do is borrow from other fields of public health, things like substance abuse disorder or sexually transmitted infections, and try to come up with a harm reduction method. We know that people are taking risks. We know that they're not following everything exactly the way we say. So we've got to give them a way to make better risk calculations, to say, okay, you're going to go hang around with people. Why don't you do it outside, or open a window, or wear a face covering, or limit the number of people that you're doing it with. We've got to try and meet people where they are, because this abstinence-only approach, as we've seen in many other public health fields, does not work. And it's clearly not working now. So I think giving people the tools to do risk calculations, to understand how they get get infected and how they don't get infected, and really give them targeted public health advice, the way we do with injection drug users. That's, I think, the better way to get people to comply and not see the number of cases that we're getting. And we can't expect people to follow everything all the time. I think people have their own hierarchy of values, and they're going to take risks that some of us might not take, but they're going to take them. And I think it's better they do it in an informed manner.
And Dr. Adalja, I do wonder to what extent it matters to see elected officials follow this guidance, essentially modeling the correct behavior at the top. And I think to what we saw a week ago, when these lawmakers were under siege, and a handful of them, reportedly all Republicans, chose not to wear masks when they were in a confined area with many of their colleagues. And at this count, we have at least 3 members of Congress who, in the wake of being together with that entire group, have been diagnosed with COVID-19. Help me make sense of this.
Well, I think it's really irresponsible when you were in a closed, confined area where people were breathing heavy, where people were scared, there was yelling, shouting. We know that that was going to be a really great atmosphere for the virus to transmit from one person to another. So the fact that there are people infected after those events is not surprising to me. And I do think that if you don't have the right to put other people at risk. And when you're in a crowded, cramped indoor area where nobody is social distancing and everybody is breathing very rapidly because they're scared, you really have to make sure that you're protecting other people. And it wasn't asking a lot to have those individuals put a mask on when they were in those situations. And I think, they should be held responsible and liable for this. I think this isn't this wasn't normal behavior, and it actually put people's lives at risk, just like the people that were rioting were putting people's lives at risk when those individuals refused to wear masks when they were offered, and now people are infected. I mean, I think that they have to answer for that.
Senior scholar with the Hopkins Center for Health Security, Dr. Amish Adalja, live in Baltimore. Dr. Adalja, we always appreciate your time.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.